Hi, I'm Neil Graham. I'm a consultant neurologist here at the National Hospital for Neurology and Neurosurgery. And my clinical expertise is primarily in traumatic brain injury, concussion, and the complications of TBI, and in cognitive neurology, so problems such as dementia and neurodegenerative disease, including conditions like chronic traumatic encephalopathy. I went to medical school in Cambridge and then came to UCL for clinical training. So I spent time here at the National Hospital for Neurology and Neurosurgery. And I developed a strong interest in the brain and neurological disorders and what we could do to help neurological patients, and particularly in research and how we can advance the diagnostics and treatments that we're able to offer. My research programme focuses on understanding which factors are important for brain health after traumatic brain injury and how we can best optimise that so people experience good cognition long into their lives. This programme of research involves multiple different tools in order to best understand what's happened to the brain, so we can work out what's going to happen to patients, so we can intervene early and best treat them. We bring together advanced imaging, blood tests, biomarker discovery, and cognitive tests in order that we can understand what are the consequences of repetitive head impacts in sports and how can we best mitigate those and promote lifelong brain health. So my approach is to try to understand very well what the patient's ideas, concerns and expectations are of the consultation, what they want to get out of it and what their priorities are. I think often doctors have their own view about what's important and what's not important, but my approach is to try to understand for that person what are the main issues and where do we need to focus our energies and where can we have the greatest benefit. I think what we're able to offer here at the National is an extraordinary mix of expertise from different areas. I think uniquely what we bring is a confluence of clinical expertise and experience dating back many, many years and academic excellence and rigour, all brought together in one place in central London in the service of our patients. One particular area of expertise that we have here at the National is in managing the consequences of sports head injuries. We've assessed lots of people who've had sports concussions and undertook investigations and developed treatment plans to get people back onto the pitch. In addition, we've got a lot of experience in understanding the long-term consequences of repetitive head impacts during sports participation. This is a particular concern in some people years after injury, when there might be a question about whether head injuries have triggered a progressive process, and oftentimes people are very concerned about behavioural or cognitive symptoms such as memory difficulties. Our team has some of the greatest experience nationally of assessing former rugby players, football players and boxers and so forth with concerns about their thinking and memory after repetitive head impacts and traumatic brain injury. We're able to bring that experience for individual patients so that we can try to be as definitive as we can do about what's happening to the brain, whether there are problems, what the right treatments are and what the future holds.